This is one of our sites, one of our phase 2 sites out of Emory. It's a university hospital system in Georgia. And Cletus Arciero, Dr. Arciero, you can see there on the left, is kind of our lead champion at that site, but we have a lot of participating clinicians. I don't even know what the N is, but definitely over 5, right, Hannah? And you can see some bullet points here about how they are doing their implementation. So it's multiple sites. So they have kind of the main hospital, and then they have other clinic sites. And the main hospital has multiple clinics in this university health system. So they've kind of expanded it amongst the whole health system in the area. Their busiest site, which is the hospital, and the rest of the sites, except for one, utilizes nurse navigators to distribute the tools via a welcome packet for patients pre-appointment. It sounds like the patients are getting it kind of at the time of the appointment, but before the clinician comes into the room. Hannah, is that your understanding too? There isn't kind of like a distribution of these materials like days in advance or something like that?
Correct. So the nurse navigator works with whatever clinician is using them to give the tools as well as Emory's own specific materials, just, after the nurse comes in, but before the clinician comes in to explain treatment choices.
Yeah, and it sounds like they've been able to standardize that approach across their multiple settings. The setting that Dr. Arciero works in, he is a little bit more pick and choose who this welcome packet goes to or who the tools go to. So he has a little bit more of a heavier hand in that selection rather than kind of being broad about it. With all the early stage breast cancer patients, it sounds like he doesn't want to use this tool with DCIS patients. So he tries to filter out some of those folks in his own clinic. And yeah, they're utilizing these tools alongside other materials that they give typically to patients. And their biggest challenge that they're experiencing, which I think all of our sites experience, is that patients are overloaded with information post-diagnosis and pre-treatment decision. And of course, the conversation aid is a part of that information overload that they're getting. I don't think that they are concerned about the tool being, the one thing that kind of tips the patient into overload, but just being wary of how much information patients are receiving prior to their appointments. And they keep that in mind, but they're implementing the tools very well and very successfully across all of their settings.